Non-skin mass excision and closure refers to removal of lumps and bumps and tumors underneath the skin. In other words, masses or lesions that are not part of the skin. So this is things like lipomas or sebaceous cyst or epidermoid inclusion cysts, things like that, which are masses underneath the skin. So we remove these by first planting our incision in the most concealed location. In other words, I want to be able to remove the mass safely without creating an unsightly scar. So first we plan our incision, and then the skin is incised. The skin layer is then elevated up off of the underlying mass. The underlying mass, whether it's a cyst or lipoma or something else, is then carefully removed. The wound is irrigated out and the skin is then closed in layers. The removed cyst or lipoma or whatever it is then sent off to the pathologist to be looked at under a microscope to give us a tissue diagnosis. The recovery from this really depends on where the mass was and where the incision is that needs to heal. In general, incisions heal best when they are under minimal tension and kept clean and moist. I will refer you to my video where I talk about what you can do to make the best scars. Following removal of a skin lesion or a mass or anything, if you don't hear from us within about 1 week, please call us so we can tell you what the pathology results are. To learn more, check out our website where you can upload your photos and concerns as a virtual consult. You can also check out our price estimator to get pricing information for all the various procedures we offer. And finally, if you'd like to have your questions answered on a future podcast or Q&A video session like this, please leave a message on our SpeakPipe. You can go to our blog page and our SpeakPipe is located there. Thanks for listening.